Hello, everyone. I'm Conrad Collaco here with Dr. Kathy Georgiades, a pediatric psychologist with the Offord Centre for Child Studies at McMaster University and Hamilton Health Sciences, and Dr. Martha Fulford, an infectious disease specialist at McMaster Children's Hospital and Hamilton Health Sciences. Welcome to you both. Hello.
Thank you, and hello.
Hello, thank you.
All right, I really appreciate you joining us. So there's an enormous amount of anxiety, feeling it myself as a parent right now over the return to school for students, parents, and teachers. And there are a lot of parents asking this question coming to us from B. Shenton. How do I make a choice between my child's physical health by sending them to school versus their mental health and keeping them home away from friends? So, Dr. Fulford, let's start with you. What does the science say that might help parents make that decision?
Yes, that's an excellent question. I think there's so much information in the media about COVID, and so much. We're almost overwhelmed with the numbers. So it is helpful to take a step back and see what we've learned since all this started in March and look at the numbers. And one of the oddly good news things out of all of this is how little this virus affects children. Certainly, I think in March we did not know this, but in August, if we look at the numbers in Canada and worldwide, children are spared for probably even less than influenza would affect a child. In all of Canada, we've had only 149 children hospitalized. We've only had 29 in ICU, and no child has actually died from COVID in Canada. The one child died with. And that's Canada, where we've had very good success with controlling the numbers. But this is true everywhere in the world. Even the United States, the group that has the least physical impact from this virus are children, are young people, and that's young adults as well. Now, of course, we still need to worry about it because the group that is vulnerable for severe disease are the elderly, particularly the frail elderly. So we do need to make sure we control our numbers so that we don't have a bad impact on those who are frail. But I'm very comfortable in saying that I'm not worried about the physical health from children from COVID. For children, they're either asymptomatic, as in you'll never know they even had the virus, or it's essentially a mild fever with maybe a bit of a cough and a runny nose. So that's one of the reassuring things about COVID in young people.
Well, let's talk about the psychological concerns then, Dr. Georgiades. What concerns you right now about the challenges parents, students, and teachers are facing as they approach school?
Yes, there's lots of challenges and concerns. What we do know from the emerging evidence is that since the pandemic, particularly since school closures and our public health measures, research has definitely demonstrated increases in feelings of depression, feelings of anxiety, feelings of loneliness in children and young people. And so the mental health impacts have been great for many children and families. They've been even greater for populations that are at risk. So children with pre-existing mental health conditions, children with special education needs. These closures have really impacted particular subgroups of our children. And schools are a setting that really help facilitate access to needed care. And so the mental health impacts have been great, and we're continuously needing to monitor those impacts as we transition back to school, to ensure that we have the effective supports in our schools, but also in our communities to support children as they transition back. So on the mental health side, the consequences have been much greater and even greater for some populations.
So hello to everyone joining us on social media. As always, we're taking your questions and comments during this live discussion. So feel free to post or just say hello to Dr. Georgiades and Dr. Fulford. So this question comes in from someone named French, who says, as you mentioned, Dr. Georgiades, the anxiety over wearing a mask. French says, my daughter has generalized anxiety disorder. wearing a mask all day will be hard for her. How can I ease her anxiety about the fall and mask wearing?
That's a really good question. And there are some recommendations that have been put forth by the Canadian Pediatric Society and other organizations to help facilitate children's comfort in wearing a mask, which will be difficult. We need to acknowledge the challenges associated with wearing a mask all day. But some strategies that have been recommended are explaining to children why they're wearing the mask. It's to protect themselves and to protect others, and to give them some ability to choose their mask and to practice wearing that mask at home, and also to demonstrate mask wearing ourselves to help normalize the use of wearing a mask. And so I think those are a few strategies that could be helpful to children who practice could really help. And Dr. Fulford, I wonder if you have any additional recommendations as a physician around mask wearing that you might want to add.
No, it is extremely challenging to wear a mask. One thing I know some schools are suggesting or considering are maybe having mask breaks where you can sit quietly somewhere without one, particularly for children who have difficulty. I know if you look at the recommendations of the ministry, which are very comprehensive, they have exemptions and things to consider that each school or school board could put in place. But masks are not all the same, and it's probably a good idea to practice finding one that's comfortable for the face. You want one where the elastics aren't pulling your ears uncomfortably. You want one that's not maybe fogging up your spectacles if you happen to wear glasses the way I do. Some of the ones with the metal nose bridges are much more comfortable because you can position them better and you're not breathing. And so I think that for the masking as well, sort of picking one that you like the look of, is maybe practice and seeing which one fits your face. Some of us have just bigger heads than others. And in the hospital, we have things that we call mask extenders, where the elastics are not around our ears, but on sort of almost like a band of cloth with buttons on it, so that we can make them more comfortable to wear. But I think the idea of practice and saying, and also I think it's also important to reassure children that masks are one of many tools that we're using. It's wearing the mask, it's being considerate in terms of keeping your distance when you can. One of the really important messages that maybe we'll come to later is that when people are sick, they need to stay home. And all of these together are what are going to work. And so part of the reassurance is that we're all doing this for everybody, but practicing and picking one that feels good on your face is important. I know the mask I wear in the community is a cloth one, but I went through about 2 or 3 maybe before I found one that, okay, this one fits my face and it's comfortable and I can wear this properly.
So I want to get to a question. This one comes in from Erin Lynn just now, who is wondering, what are some practical tips for educators to support the return to the classroom, mental health, for our younger learners, keeping in mind that we can't be physically close, not share physical materials, toys, sensory tools? I know this is a concern for my wife, who's a teacher as well. Throughout her entire teaching career, she has been close to the students, and part of her skill as a teacher is the personal connection that she makes with these students. So what would you say to Erin Lynn? What suggestions do you have that might help her when she returns to the classroom?
I think communication is clearly important here in terms of trying to communicate to children why we have certain precautions in place right now, such as physical distancing, such as wearing the mask, so they understand the reasoning behind some of these measures and making those clear. And I think we can create connections in other ways as well, even if we need to maintain that physical distancing. So allowing children to express their emotions, acknowledging their emotions, validating the feelings that they have, identifying supports within the classroom that they can share what they're feeling within that classroom and some of that frustration that children or educators are feeling. But I think clear communication always around why we're doing this could really help children understand that these rules are in place to help protect myself and protect the people that I care about within my classroom and within my school.
And also, I think one of the reasons, if I can jump in, for having cohorts and clearly identified groups is that we know that schools are actually not where most of the outbreaks occur. It's from the community. So if we have really good control in the community and really low numbers in the community, which we do have right now, the risk of having any virus in the school is extremely low. I mean, if you look in Ontario, 29 out of 34 public health units have less than 5, and 20 of them have no current cases. And so when the numbers are low and we have really good control in the community, the risk of having a virus in the school is very low. And as we go forward, we're going to have to be a little bit flexible and adjust, but within the cohorts, we may be able to reevaluate and say, okay, these kids are allowed to play together. It's a defined group. If somebody unfortunately got exposed to somebody, we would know that it's just this little group of people that we need to have a close eye on. And one of the comforting things, of course, is it's not the children who are going to become severely ill, but possibly other contacts. And so as it evolves, I think we need to be a little bit nimble and flexible. But these rules right now are as we go into it. But if we as a community do all this bundle of precautions, then and we have a low numbers in our community, then the numbers in the school will also be very low. And if we can prove that we can do that, then we can normalize things a lot more for our children. And certainly if you look at other countries that have done this, and I think Germany right now is a very good example, they're doing exactly what our ministry has recommended in terms of the cohorting, fast testing, and just if something happened, it's a little group. But they've been successful in reopening schools without having massive breakdowns in or needing to have quarantines or shutdowns. And so I think it's the communication thing. But I think particularly with younger children who we know don't transmit the virus very well, that we may be able to start to allow a little bit more friends. And that's the whole point of bubbles and and cohorts, I should say, is that in that group, you're allowed to have much closer interactions.
You mentioned Germany as a location where school reopening has had some success. Now, there are a couple other jurisdictions where there has been a failure. So we've seen problems in Israel and in the Southern American states. What went wrong in those locations? Why, when there are outbreaks, why have they happened?
Both of those actually were examples where the virus was brought in from the community. So that's where you've got community transmission. So it's not the school that's the source, it's the community that's brought in. Very important is that people who are sick should stay home. Because people are symptomatic, more likely to transmit the virus. And when we talk about the schools that have had outbreaks, I always think it's important to remember that for the two examples we have of where there were school-associated outbreaks, there were hundreds and hundreds and hundreds of schools that reopened without outbreaks. So it is, of course, always important to try to balance this. The other reassuring thing, even though I certainly do not want any school outbreaks to happen, but the reassuring thing is when we do look at the school outbreaks that have happened worldwide, they didn't actually lead to bad outcomes. It didn't end up causing an increase in hospitalizations. Nothing bad happened to anybody as a result of the outbreaks. They were quickly identified and contained. But part of avoiding this in the first place is, like I said, is for us as adults to control in our communities. But it is important that most schools have reopened with no difficulty, and that's across the world where schools have been reopening, and that would be mostly Europe and Asia that I'm thinking of when I give these examples.
I'll pass on a comment from Melanie Foreman Marcus, who says, already I appreciate the calm response of how this physically impacts children. If you listen to the majority of headlines, it's stating the opposite, and I believe this is where a lot of parents' fears are coming from. Do you think that's true?
Do you want to start, or should I? I can. Yes, I mean, that's very much true. And I think one of the difficulties is there are several things I see. One is it was scary in March when we didn't know what was happening, and we had some fairly nightmare scenarios in the media. And also, it's not the United States, which has had very poor control. And so I think there have been some difficulties. But as we've learned going forward, we can very clearly put tiers of who's at risk. And it's reassuring. It's not children. It's not children who have been hospitalized. It's not children who are really sick. So that is, in fact, an important message for parents. There are clearly households that might have a higher risk grandparent. I think there's lots of unique situations. But for children, their physical health is one that we should be comfortable is not going to be compromised.
And I would just add around that being bombarded by social media information and potentially misinformation around COVID, that's another strategy as parents we could try to control so our children are not exposed, because there is evidence to suggest, being bombarded by this information day in and day out can have an adverse effect on all of us, but particularly children who will have a difficult time understanding what does this death toll mean and to put it into perspective. And so I think that information, as parents within our homes, as much as possible, try to control what children are hearing and what and how they're interpreting this information.
Yeah,
That's an excellent point.
If there's support here for getting students back to school, one of the challenges that educators face is that in-class learning, we know, is more successful for most people than virtual learning. Some students, for sure, are going to be learning from home. So how concerned should parents and students be about the knowledge loss that might occur, that tends to occur with a lot of students when trying to learn through a virtual classroom? How much of a concern is that for you?
I think during the spring, or when schools were closed in the spring, it was a concern because I felt like schools were really trying to pivot very quickly into a new environment for education, virtual learning, remote learning. Lots of challenges came to play very, very quickly that needed to be addressed. Over the summer months, the Ministry of Education has worked hard to develop programming for remote learning. Educators have been trained to deliver this newer platform of learning. And I think our priorities during a pandemic need to be dual, in the sense of the children's learning needs, but also their social emotional needs. And as things subside, and hopefully the stress around the pandemic subsides, our ability to learn and our ability to take in this information will increase. And also, I think the first few months of transitioning back to school, whether it's virtual or in person, educators will be cognizant of differences across their students within their virtual classrooms or their regular classrooms, and try to supplement whatever learning losses might have occurred over this past 6-month period or so.
Well, I want to talk a little bit about the Ministry of Education. Dr. Fulford, you were one of the doctors who contributed to the document published by Sick Kids Hospital, Guidance for School Reopening. The document called for smaller class sizes, and Premier Ford and Education Minister Lecce didn't go in that direction. Why are smaller class sizes important for those who return physically to schools?
It's the whole bundle of packages. I mean, it's what we call a hierarchy of controls, and there's no one intervention. And so there's no absolute answer to class size, because of course a lot depends on the size of the classroom. But really, it's the message is the whole bundle of things we can do. It's ensuring that we avoid crowded situations, particularly where there's a lot of close contact. It's putting up barriers where barriers might be helpful. It's ensuring that we have good hand washing ability. That's a very important one, because a dirty surface, a virus on a surface doesn't jump onto our face. It's transported there by our hands. So it's ensuring that we have access to cleaning hands. It is masking when you can't have the social distancing. And that's where the classroom size comes in. If we can avoid the crowding and the close contact, then we decrease the risk of transmission of any respiratory virus, actually, not just COVID. But these interventions will work for any virus. It'll work for influenza. It'll work for any of the other respiratory viruses that we normally deal with during the winter months. And so the guideline that we put out, that was spearheaded by my colleagues at the Sick Kids, is the whole package of everything together. And I think in a perfect world, we do absolutely everything we could. But I would stress that for me, I think we all want our children to have a childhood. We all want our children to be educated, and we're putting in as many of these things together as a package as we can do. But for me, it's very important. There's no one thing that makes a difference. It's the whole bundle of everything together. And maybe we're not going to be able to have perfect class size. We probably won't have perfect physical distancing. Not everybody's going to wear a mask perfectly. But if we do our best with all of them, that bundle of all of those things we're doing together is going to decrease the rate of transmission of the virus.
Yeah, I wonder too. You mentioned our ability to not get infected by other viruses. I'm very curious to find out what the average cold and flu season will be
Yeah,
like now that we are, most of us anyway, so much more vigilant about washing hands.
yeah, yeah. There's early, sorry, oops, my earphone just came out. Sorry about that. There's early data to suggest that they're seeing very little influenza in the Southern Hemisphere in Australia and New Zealand. So it'll be
Okay.
very interesting if our numbers go down.
All right. So are you saying we have found the cure for the common cold and it is hand washing and mask wearing?
Look, hey, I've always been a fan of hand washing. So,
So
and I've always been a fan of not don't go to work and don't go to school when you're sick. I
yeah,
mean
right.
that's a really old-fashioned message that people like me have had for a long time.
Yeah, and let's talk about that. There is a lot of pressure at workplaces, has been for decades. If you're sick, suck it up, go in. Cough if you have to, bring a tissue box, but get your job done. Are we going to see? Are we going to see employers change the way they view people who come into the workplace across, not just in schools but everywhere else?
Well, I hope so. I mean, this is a huge societal change. It's sort of certainly well beyond any scope I have to implement change. But do I think that we should allow people to stay home? And in fact, I mean, I think you could find a talk I gave 5 years ago to medical students on infection control where I said that people who come to work sick should be shamed and sent home. Well, not shamed, but should be encouraged to go home. So my advice hasn't changed. But yes, we actually have to have something that allows people to stay home when they're sick, to stay home when their kids are sick. But that's at a whole different level of discussion. But yes, we shouldn't think it's a good thing, and we should not be proud of going to work when we're sick. I think that is a mindset change across all societies.
We've got a comment from Louise who is wondering. She says some kids are not returning to school because they live in households with adults who are at risk. Any tips, Dr. Georgiades, for parents to support the mental health of their children who will be staying at home?
Yes, definitely. A few strategies that are day-to-day strategies that could help with continuing to learn from home in this virtual learning environment. I think it's really important to try to facilitate opportunities for socialization still with peers, with family members, whether they be virtually or within their social bubbles. Really important to do that, to continue to engage in activities that help them feel a sense of belongingness and connectedness. Physical activity, sleep hygiene is really critical. It's easy when we are home and lack structure to be sleeping or being up all night. Many people have commented on teens who are up all night sleeping in the daytime. So sleep hygiene is critical. Physical activity, monitoring the amount of screen time youth and young people are using. I think those are important elements, but socialization is a piece that is a concern for individuals or young people who are learning from home, and ensuring that there are opportunities to socialize, and also to engage with their educators and their virtual classrooms as much as possible if they have concerns that their child might be struggling with feelings of loneliness or anxiety or fears, that they can reach out to an educator for support. Our schools and School Mental Health Ontario, which is an organization that supports all 72 school boards in the province for the provision of mental health supports, are there to help support children who might be struggling with mental health, whether it be in person or virtually. So there's supports embedded within our schools currently that can help students that might be having a bit of a difficult time.
Thank you very much, Dr. Georgiades. Maybe after our conversation, I'll ask you to pass on some links, and I will share them with our audience as well, to both of you, really. Thanks to you both very much for helping to sort out some of this confusion. I'll leave the last word to Patrice on Twitter, who said, "The best line I've heard was from a nervous doctor dad. I'm really going to worry if my son goes to school in a Spider-Man mask and comes home in a Ninja Turtles mask." So,
Well,
um,
I can actually finish with one of my colleagues at Sick Kids. His child came home from kindergarten wearing another little girl's pair of underwear. So, so kids are kids.
all right. Well, probably safe from COVID, I guess, but
Very safe from COVID. I think we just have to be very kind and tolerant to each other. Things will happen, but I think again, if we all work together and we do everything together, these little incidents we can laugh at and we won't get too upset.
all right. Kindness, tolerance, and listening to the experts, the scientific experts. So I appreciate that contribution from both of you. Thanks to everyone who participated in the live chat with questions and comments. Thanks in particular to producer Haley Zimak and executive producer Rick Hughes. We do 1 or 2 of these live chats every week. So if there's someone who you want to hear from, let us know. Follow us on Facebook, Twitter, and Instagram at CBC Hamilton. I'm Conrad Collaco. Thanks very much for watching.